My name is Dr. Samuel Otido. I'm a pediatrician, I'm a chest specialist. I'm also part of the team that handles critical care in the hospital for children. This morning we are here to discuss about emergencies that you can handle at home in case your child is faced in certain emergencies, and before helps arrive, you need to do certain things so that you are able to save your child. So we begin with choking, on what to do if your child has an emergency of choking. Choking is when an object obstructs the airway. So it can be food, it can be a toy, it can be a piece of marble, it can be anything that the child will be playing with and possibly put in the mouth, but it doesn't go to the food pipe, it goes to the airway and it blocks the baby from breathing. So that's what we call choking. So with choking, if you're alone with your child, it also depends on how old the child is. If the child is below 1 year, there are various ways where we can try and remove the object that is blocking the airway. If the child is above 1 year, there's also a certain way you can help your child to remove that object. So I will demonstrate both ways. So this is a baby who is below 1 year of age, and possibly from feeding, this baby has choked. So the food is now going to the airway and he started coughing. So if you notice that your baby is coughing and the coughing is good, a very strong cough, allow your baby to cough it out. So that coughing reflex may actually remove whatever is blocking the airway. But sometimes you can be in a situation where the baby is unable to cough it out, and basically what happened is they're losing oxygen, air is not getting in, and they may start becoming unconscious. So this is what you need to do if your 1 year below child is choking and unable to remove the object. So first, you turn your baby. So you put your baby on the lap, head facing downwards. On your lap so that you're comfortable, you're supporting the head so that the head is not lagging down. And then you give strong 5 back blows just in between the shoulder blades. So as you do this, you're trying to remove the object that is lodged in the airway. So this is how we do it. Then you turn your baby and see if the object has moved and it's almost coming out. So you have to look inside the mouth and see if the object is there. If the object is visible and you can see it and you're not able to remove it with your fingers, kindly do not push your finger inside because you may push the object further. But if it's able to be grabbed, you can grab it. If it's still far away and you have done your 5 back blows, you turn your baby this way, head also facing down, lower than the chest, and you give 5 chest thrusts. Okay, and you still have to come back and look into the airway and see if the object has moved. If it has not moved, you turn your baby again and we repeat the same 5 back blows. And you turn your baby and look if it has moved. If it's still not there, you repeat again the 5 chest thrusts. Okay, so in case the object has moved and you're able to see it and you're able to grab it, that's the only time you can grab it and remove it, and then your baby will be able to be breathing well. If you're still having problems and the object has been lodged, you can call for help from the hospital or an ambulance that is going to assist you. But in the meantime, as you still await for it to come, the ambulance, you still continue with your back blows until help comes. So because your child is choking, you being the caregiver or you being the mother, possibility of panic is very high. But in this particular situation, we do encourage you as a caregiver to gain that strength, because every second that we are losing and air is not entering this child, we're becoming more and more unconscious. So getting that courage to do first aid is very, very important. We do encourage you, if you're able to do any course, please do the course for resuscitation, the basic ones. But as I have demonstrated, use it, use the skill to remove that object as help is coming. So giving water is not advisable, because water will go into the food pipe and this object has been stuck in the airway. So our main objective is to remove the object from the airway. So water will not help. It may even possibly worsen the situation and make the child even more uncomfortable and worse in breathing. So now I will demonstrate the choking of an older child, and the same can be used for an adult. Okay, so this is a toddler or even an older child who has been eating and has choked on a piece of meat. So we want to demonstrate on how to remove this particular object that is obstructing the airway. So for this one, if the child is able to cough, again, let them cough, because coughing will help in removing the object. So a strong cough reflex removes something that has blocked. But if the child is getting tired, the child is becoming unconscious and unable to breathe, and the cough is not helping, this is the maneuver that we use in trying to remove the object. So we face the child facing away from us. We put our wrist just below the breastbone, like this. And then we put one hand here. As they are facing forward, we are trying to do chest thrusts. So we do 5 of those ones to try and dislodge the object that has blocked the airway. Okay, so you do 5 times. And again, you still try and see if the object has moved. If it has not moved, you do back blows. So child is bending forward, leaning, and then you hit 5 back blows in between the shoulder blades. Okay, and you turn again, see if the object has moved. If it has not moved, we still go back and do our chest thrust. So we fold our fists and we put our hands here. The child is leaning forward and we do 5 chest thrusts. Okay, come back again and see if it has moved. If the object has moved and you are able to grab it, you may grab it and remove it. If it's too deep, kindly still don't put your fingers inside the mouth, because you're at a risk of pushing it further down and worsening the situation. So as you call for help, you still continue until the object comes out. Okay, so that's how we remove foreign bodies which are stuck in the airway for a toddler and even an adult. So in case you're successful in removing the object which has been stuck in the airway, it's still very important to seek medical attention, because what happens when we're doing all the maneuvers of the back blows, of the chest thrust, a little bit of the object can break away and still remain in the lungs. And that will be very, very important for the doctors to evaluate and see if there's a foreign body that remained in the airway and which we can be able to remove. So any child who was choked and you have removed their object, kindly still take your child back to the hospital for an evaluation to see if everything indeed came out. So in case a child has taken something as solid as a marble, as a bean, and they're having the sensation of choking, so that choking is basically you're feeling as if there's something here, holding their hands here, okay? They're coughing a lot, their eyes are almost popping out, becoming red, they're turning color. So those are the signs of choking. If those signs are not there, possibly the child has swallowed it wholly into the stomach, or if the coughing has been there and it's probably not getting as worse, they were able to cough it out. So those are the scenarios you can use if it's a solid. So how can we prevent choking in our homesteads? So first, what you need to do is having supervised play for your child. So the child who is crawling in the house or even a toddler, watch out everything that is in the environment, the small objects that are lying around, the small toys, so that the things that you can pick and put them away, or if the baby is playing with them, kindly always be supervising them. So we don't let the babies actually just play alone. Again, children who are supervised by fellow children, that will be a problem. So we only allow a smaller child, possibly a toddler, to be handled by somebody who is probably 16, 18 years and above. Those are the ones who are able to monitor the child and prevent them from choking. So for a smaller baby who is probably breastfeeding, sometimes you may find that they have that reflux. So that is milk which has gone into the tummy already, coming up. Sometimes it may come out through the nose, sometimes through the mouth, and a little bit of it can go into the airway. So that may cause a little bit of choking, and you see that your baby is coughing a lot from that situation. So what you need to do in that aspect first is to prevent it. So if your baby is breastfeeding, kindly let them burp. Kindly put them in this position. So you can hold them like this. After breastfeeding, 15-20 minutes if your baby has regular and more than the usual reflux. So you keep them in an upright position. That will help the milk to go down. And when they're also sleeping, kindly also just let them sleep in this particular way. So your bed is elevated as opposed to being flat like this. So immediately you feed, do the burping, you can hold your baby and have the bed just slightly elevated so that milk has no way of getting into the airways. Burns is also another emergency that happens in our homes. There are various types of burns. So you can have burns from flames, you can have burns from a hot object, and as well you can have burns from liquid. So liquid could be hot water, it could be tea that is just lying around the table and your child is grabbing the cup and the hot liquid falls on them. So those are the types of accidents that can happen in our homes. So what do we do when we experience this emergency in our home and you are alone? So first of all, you remove the child from the environment where there is danger. So if there is flames in the house, try and remove the child from that environment as you are protecting yourself as well. Okay? So if it is hot water that the child has been immersed in by mistake or by accident, you remove the child from that environment. So that is usually the first step when you do first aid for burns. The second step is to run cool water along the burn surface. So let's say, for example, this particular area has been burnt. So I can open the tap and let the cool water flow continuously. So this cool water also just helps in reducing the heat which is now on the skin and is causing pain. So let it run 15-20 minutes on it, even if it's on the chest, even if it's on the back, if it's on the legs. Let the cool water run continuously. So I've not mentioned cold water or icy water, because that can again cause damage to the already damaged skin and the tissues below. So cool water is the one that we do recommend. We don't put ice packs on top, or cold objects like an even ice or cold meat like people do. So it's just cool water running and running through. If the burn is inside our bodies, try and see if you can remove the clothing. So with hot water, you can remove. With flames, sometimes it becomes difficult because the clothes can actually be stuck on the skin. So if you try and remove the clothing and you see that the clothing is stuck on the skin, kindly do not proceed, because you might actually cause more damage to the already damaged tissue. After removing the clothing, if it's possible, you can put cling film. So cling film is protective. So put it around the burnt area. It's going to protect even germs from entering and causing more damage through infection. So cling film is the next thing you do. Then after that, you give your child painkillers. If you have paracetamol at home, you give your child. If you have ibuprofen, in other words called Brufen, you can give your child as well. If your child is below 12 years, we do not recommend giving aspirin, because that can have side effects on smaller children. But the older people, older children above 12 years can be given aspirin. So it acts as a painkiller and also helps in reducing the swelling on the burnt tissue. If the burnt tissue is excess, so what do we mean by excess? We use the palm of the child and to try and measure. So if it's more than the size of the palm of the child, that's a big burn, and that needs to be addressed in a hospital. And if the burns are involving the fingers of both hands, if they're involving the joints, if they're involving the feet, if they're involving the toes, if they're involving even the diaper area, that child needs to be seen at the hospital, because certain damages can occur if you try and manage from home. Also, we try and avoid putting things on top of the burns like Vaseline. Some people put butter, some people put even the margarines like Blue Band. So we try as much as possible to avoid those ones, because it's not going to be helpful. So also salt is not recommended, because that can also cause damage to the tissues. So the main thing, if you have a cling film, put it around the burn surface. If you don't have a cling film, you can actually use a clean polythene bag to cover the wound. Another emergency that can happen in your home and that you need first aid before help comes from either an ambulance or from any doctor, if a child has collapsed at home. So this means that your child is unconscious. You need to do certain things to make sure that your child is stable and you save their life. So in case you find your child has collapsed, either through fainting or if they have been unwell and they have lost consciousness on the floor, there's a position we call a recovery position that you need to do. Before you do that, make sure that your child is breathing. If your child is not breathing, then you need to do what we call cardiopulmonary resuscitation. That's the CPR. That's an advanced one. You probably may need to undertake some courses on that to see how you can do chest compressions and also breathing through mouth-to-mouth resuscitation. First, I'll show you how to place a child in a recovery position when you find them unconscious. In case you find that your child has collapsed and you look and they are breathing, so you can see that they are actively breathing and they are not in any immediate danger, you need to position them so that they are able to breathe even better and they are not choking even on whatever is in the mouth or even their own tongue. Okay? So putting the child in a recovery position, you put this hand at a right angle of the body. Then you take this hand and you put them just on this cheek. And for this leg, you put it at right angles like this. And then you turn your child to face this way. So this foot is on a right angle. This one is lying straight downwards. This hand is protecting their head. And this one is preventing them from rolling over. So this is what we call a recovery position. It actually helps, and you tilt the head so that they are able to breathe better. As at this moment, you now call for help, and you're hoping that the ambulance will come on time to help you in this situation. So if a child is collapsed, we don't leave them flat. On the ground. We put them in this position so that they're able to breathe better. So for you to know that your child is breathing, first you have to look. So you look and see if the chest is moving up and down, up and down. You can actually even come close and listen. You can actually listen and you can hear them breathing, and you can even feel the warmth of their breath on your cheeks as they are breathing. That's the way to ascertain that a child is breathing. So how are we able to prevent injuries and these emergencies in our homestays? So first of all, again, you have to always monitor your child. Always have hawk eyes on where your child is. Look at them, never leave them unsupervised because those are the dangers and accidents can happen at home because children are still growing, they still don't know what is right and they still don't know what is wrong. So always have somebody watching over them, an adult preferably. Also look at the environment, make sure you don't have lying objects on the floor. So those are the things that children are tempted to put in their mouths and they can end up choking. Clean environment, put everything in place out of the reach of children, including even medications. The other way to prevent injuries, especially now the burns, is to always monitor the water, like the water for bathing. Make sure that it's on the temperature that is preferable. Before you put your infant, you can check with your elbow, make sure that the temperature is okay. And to do that, you can actually even start with cold water as you pour the hot water on top. The other way you can prevent is don't allow your kids to be in the kitchen alone. So kitchen again is where most of the accidents do occur. So if they're in the kitchen, have an adult observing them. Them alone in the kitchen, you'll end up having injuries from burns to cuts and falls. So those basically, supervision is a mainstay of prevention.